Hi, my name is Kaelyn. Thank you for attending my speech about LASIK eye surgery. These are my audience, and my sixth person is my recorder. Say hi.
Hi.
Okay. Does anybody have trouble seeing? Okay. Does anybody have glasses or contacts right now? Okay. Those with you with glasses or contacts, would you want to see better without them? Okay, so you want 20/20 without your help. Okay. Our senses are very important, don't you agree? Okay. Our senses are very important. They help us survive. Seeing is actually one of the main ones. Because if you can't see, you can't do a lot of things. Does anybody know what LASIK eye surgery is prior to this? A little bit? Okay. LASIK stands for laser in situ keratoconus. Okay? That's why they abbreviated for one. It is a surgery for people who are nearsighted, farsighted, and have astigmatism. Y'all probably know what that is based on seeing the certain contact commercials on TV. LASIK reshapes the cornea of your eye. Does anybody know where the cornea is? It's the clear part on your eye that helps you see. Today we'll discuss the advantages, side effects, how to prepare for the surgery, what happens during the surgery, and what to expect after the surgery. The surgery sounds a little crazy, right? Laser in your eyes. But wouldn't you want to see better? Right? Okay. 96% of patients have their desired vision after they get the surgery. So 4% don't get exactly what they want, but they can see better. So I would take that odds, would you all? Okay. LASIK has very little pain involved. Okay. You really don't feel a thing. They put in anesthesia, they put numbing drops, you're good to go. Vision is corrected that very day or the next, which is, I believe, is pretty impressive. Wouldn't you all agree? Okay, because a lot of surgeries you have weeks and weeks and weeks to get back to normal, right? And you have no bandages or stitches, so you have to wear that scary eye patch or whatever, which some people think that can be embarrassing. Of course, just like any other surgery, there can be complications, okay? It's surgery. Things can happen. Some patients have a little bit of discomfort in the first 24 to 48 hours, which that's okay. I mean, it's better than weeks after trying to get back to normal, but I'd take those odds. Some side effects that rarely occur, again, rarely, so probably out of those couple % of people that don't get exactly what they get, they probably have these side effects. There's glare, seeing halos around images, having trouble driving at night, and dry eyes. It is important to be proactive, not just in this situation, but in things in general in life. Before the surgery, the patient will meet with the coordinator or the surgeon, talking about their prior medical history, not just eyes included, but health and history in general. And they will take an eye evaluation. Now, granted, just because you have trouble seeing and you have glasses or whatnot, doesn't mean you can get it. Some people do not qualify, which it's unfortunate, but that's just the case. Like some people, they need to have surgery on their back, but they can't get it due to like their heart, like how the blood flows. There are just some things that just can't happen. There are ways a patient should prepare for the surgery. A patient should not wear their contacts 3 days prior, and then there's a certain type of contacts with, I believe it's a glass type fiber. You cannot wear those for 3 months prior to the surgery. And for ladies, no makeup at all. And then for ladies with long hair, no big hair bows, no bobby pins, no ponytails. And then for everybody in general, no jewelry. No earrings, no nose rings, belly rings, necklaces, bracelets, anything. On the day of the surgery, a light meal should be eaten. So definitely don't go there without anything in your stomach because you're going through surgery, but don't be going to Bob Evans buffet, okay, and grubbing everything down. Knowing a procedure down, like knowing step by step what's going to happen, is vital. You don't want to just go somewhere, be dropped off, and oh, what's going to happen to me, right? You don't, because it could be harmful. You don't know what you're getting yourself into. That's why you sign documents and everything. An instrument called a microcuratom or a femtosecond laser is created a thin flip, and it flips the cornea. The cornea is pulled back and it reshapes the cornea so it helps you see. Patients are under anesthesia during the procedure, and before the procedure they put a little bit of eye drops so it numbs it. It's kind of like when someone gets their wisdom teeth taken out. They numb it, but you're going to be in a little pain afterwards, okay? Recovery can be difficult at times, but it's totally worth it. The patient's eye will be dry temporarily even if they don't feel it. The doctor will give patient eye drops. Do not use your eye drops that you already had at your house. These are special eye drops, prescription from the doctor. Your vision may be blurry, but a follow-up schedule will be visited just like any other surgery. Our senses are very important, and now we have a way to improve them if they are going wrong. This is a little off topic, but for example, if you're hearing loss, what do you get? Hearing aids, okay? We have covered the advantages, side effects, how to prepare, and what happens during surgery and what to expect after surgery. Are there any questions? No. Thank you for taking this time. See you next time.